Good afternoon. I'm Linda Klavinskis from King's College London, and with Dr. Nathalie Garcon from BioAster, we have the pleasure of chairing this final plenary session of the 2021 ISV Annual Virtual Congress. So in this session, we have two complementary talks from leaders in the vaccine field that will focus on what is required to develop and manufacture vaccines that will impact health in a global setting. So the first talk will give an overview of setting up a research unit and the challenges encountered in transitioning from a research-based operation to a vaccine manufacturing company that has a mission to produce affordable, stable vaccines at scale that can make a major impact to improving global health in low-resource settings. And the second talk also links to the global theme by reviewing progress that has been made towards identifying a correlate of protection for COVID-19. So this is of immense importance, as a recognised immune correlate will have significant implications for vaccine developers, regulators and policymakers to accelerate new vaccines to licensure, and it will undoubtedly also enhance vaccine availability and thereby impact global protection against SARS-CoV-2, particularly in low and middle income countries where vaccine supplies are most needed. So let me now move on and introduce our speakers. So it's a real pleasure to introduce our first speaker, Dr. Subhash Kapra. Dr. Kapra is the CEO of Inventprise, a biotechnology company he established in 2012 to develop bacterial and viral vaccines to improve adult and child health, particularly in low-resource settings. Dr. Kapra has over 45 years of extensive scientific and commercial expertise in the biotech sector, developing vaccines, biotherapeutics and biopharmaceuticals, and this includes a substantial amount of time at the Serum Institute of India, where he was a key driver in building the Serum Institute from a small-scale domestic vaccine producer into India's largest biotech business. Dr. Kapra holds over 70 patents from his lifetime's work in the biotech sector, which is truly impressive, and he has also received many honours for his work. Our second distinguished speaker is Dr. Peter Dull, the Deputy Director for Integrated Clinical Vaccine Development within the Global Health Division at the Bill and Melinda Gates Foundation. He provides technical and strategic guidance on clinical development to the Foundation's strategy teams and external partners. And during the ongoing COVID-19 pandemic, he has also co-led the COVAX clinical SWAT team, providing agnostic support to developers to accelerate vaccine licensure and WHO pre-qualification with a low middle income country focus. Prior to joining the Foundation, Dr. Dull was the clinical franchise head for meningitis and sepsis vaccines at Novartis, where he led the clinical development and global licensure of several meningitis vaccines. He's also served the infectious disease community at the US CDC as an epidemic intelligence officer in the meningitis and special pathogens branch, following his specialty training in infectious disease at Emory University. We look forward to both your talks and welcome today.